The monkeypox virus has reached Pakistan just days after World Health Organization declared it a global health emergency. Indian authorities are also on alert. Is Mpox the next pandemic? News9 Plus Decodes. Mpox is a viral infection disease similar to smallpox. Almost a lakh cases and over 200 deaths were reported from 116 countries between January 2022 and June 2024. While Africa is the most affected, the virus has also reached America, Europe, the Western Pacific, and Southeast Asia. 3 cases have been reported in Pakistan. And the virus is spreading at a faster rate due to mutations. It is only a matter of time before India also sees Mpox cases. So how does Mpox spread? It is transmitted through physical contact with an infected person, including sexual contact or contaminated materials such as clothes or bedding. Contact with an infected animal can also cause animal-to-man transmission. What are its symptoms? Mpox causes rashes and lesions, along with fever, headache, joint pain, and swollen lymph nodes. Symptoms can be seen in 1 to 21 days after exposure to the virus and last for 2 to 4 weeks. Children are at greater risk. Currently, there are 2 reported strains of the virus. One is more virulent than the other, with a mortality rate of 10%. So how safe is India? WHO data shows that in 2022, India had reported at least 27 Mpox cases and 1 death. The current global upsurge will sooner or later bring the virus to Indian shores again due to international travel. Overcrowded spaces, compromised immunity, and lack of awareness and testing make India vulnerable. Public health advisories, thermal screening, and contact tracing are among India's measures to prevent an outbreak. The Tamil Nadu airport and port officials have been put on high alert. Visitors, especially those arriving from the affected African nations, will be screened. History of travel in the last 3 weeks will also be checked. Hyderabad is also on alert as it is a popular destination for African students. Avoiding direct contact and wearing protective clothing can break the transmission chain. There's also a need for greater access to vaccines to control the transmission. Currently, there are 2 WHO-approved vaccines for Mpox, and manufacturers have been asked to support WHO's global efforts against Mpox, especially in lower-income countries.